all so much for coming on this warm, dry, sunny day. Beautiful day outside. So thank you all for braving the weather and whatnot to come. So today we're going to talk about kind of a sensitive, maybe a vulnerable topic about memory changes, what's normal, what's not, and what you can do. Okay, and this is my coworker, Sarah.
Hi everyone.
Okay, and I'm Rob. Okay, we're the speech therapists here, and we're also referred to as speech language pathologists. Y'all let me know if it gets too far from you, if you can't hear. Okay, so speech therapist or speech language pathologist is what we're commonly referred to as. Okay, so what is the focus? Because I say this because a lot of folks think speech therapists, well, they work on speech and that's it. But we actually work on a lot more. So we work on speech, language, voice, swallowing, and cognition. So some different hats there. It keeps things interesting. All right. Let's see here. So what is cognition? I'll turn this over to you.
Hello. So these are a lot of big words here on this slide, but once we get into it, you'll know that this is stuff that the brain does every day on its own. It's innate and also learned. Cognition is a combination of these tasks that a brain performs. The first is attention, the ability to maintain focus on a task, to be able to shift our attention between 2 or 3 different tasks. Then the next is executive functioning, which means our ability to plan and organize and initiate tasks and complete them in a sequence. And the simplest form of executive function, the example that I can give you is maintaining a daily routine, maintaining a calendar, following the routine that we set for ourselves. Learning and memory is a big one, and it's just the ability to encode information and then recall it when it's needed to complete a task. And this includes short-term memory, things that we need to remember in order to perform just a task that we're attending to, and long-term memory, which is stuff that happened years ago and it stays in our mind. Insight is ability to recognize our own strengths, limitations, and then be able to judge whether a task that we're performing, do we need to learn more, or can we do this on our own, or modify it in any way. Social cognition is the use of language in social context. Our ability to understand humor and metaphors, and adjusting our communication according to the environment that we're in. Problem solving, the ability to be resourceful, figure out ways to resolve immediate and long-term issues that we're facing. And finally, perceptual motor bit is our ability to coordinate the body's movements in response to the environment around us. Something as simple as if we're walking in a room that's cluttered, there's stuff on the floor, how we're going to navigate it, that sort of thing. So these are the key domains of cognition. Language is also part of that, but that's another big piece altogether. But language is also key to this.
And I kind of jumped right in, forgive me, but I wanted to let you all know, Sarah she goes between Guilford and West, so she kind of jumps back and forth, and I'm primarily here at West. So just kind of to let you know. All right, so today we are discussing mild cognitive impairment. It's often referred to as the in-between state, so kind of an in-between normal aging. I can use this fancy little remote here. normal aging, kind of senior moments, as we like to call them sometimes, or more significant symptoms, kind of the difference between the two. So examples of normal aging, something like occasionally forgetting where you parked your car, or forgetting someone's name and then remembering it later. You know, suddenly waking up in the middle of the night going, I knew her name was Jane. All right, and the more significant symptoms that cause concern are difficulty finding the right words to say, missing important events or dates, losing focus, or easily distracted, increased instances of misplacing items, or trouble following conversations. So these are the kind of things that become more evident in decreased memory, decreased cognitive functioning. That's a little bit different from the senior moments. Okay. And this is an image to just kind of show you some structures in the brain related to cognitive function. Here we have the lobes of the brain, and it talks about frontal lobe. There is executive functioning, things like problem solving, judgment, language production, planning, things like that. Temporal lobe, mainly memory, musical awareness, learning, hearing, feelings, organization and sequencing. And then we have the parietal lobe, which also has academic skills, visual perception, which also kind of leaks over into the occipital lobe, which is the main area for vision. Then you have the cerebellum and the brainstem, which are more of the life-sustaining. Oh yes, I can be a bit louder, I was just told, so I apologize. I'll hold this a little bit closer, and feel free to tell me if I'm not speaking up. And so over here, this is one of the structures in the brain called the hippocampus and the amygdala. So right there in the center, hippocampus and amygdala, and it's actually deep inside the temporal lobe that you can see in green over here. And that's one of the main areas with short-term, long-term memory, learning, and spatial memory. Okay? Just thought I'd throw in a little anatomy lesson there. Okay, so if I or my family notice the more significant symptoms, what can I do? How would you go about this? I know this is a sensitive topic, and it's hard to bring up. Obviously, it's a little bit easier with a physician, but this is just kind of one of those vulnerable topics. So, seeing your healthcare provider, okay, going in, they like to do screenings. They'll do like an annual screening that I put down here. Remember these 3 items. I'm sure you guys have heard something like that. In an annual wellness check or just a general assessment, as well as the clock drawing. I'm sure you guys have seen something like that before and love that, I'm sure. So following this assessment, your physician may refer you for an evaluation and treatment with us, the speech therapist. Okay? You can also request a referral if you notice these things and it's concerning to you, and you can just ask your physician, can you refer me, can you write an order for me to have speech therapy or cognitive therapy, right? All under the same umbrella. Okay, so in many cases, if you go beyond, or if your curiosities lead you beyond just the basic assessment that the physician provides, you can always, they will do blood work, and they can determine different things from blood work. But this is just to also show you what it looks like. This is a neuron inside your brain, the kind of purplish blue. And then you have some tangles and some plaque those will kind of show up if there is some kind of, I like to call them sometimes memory hiccups. So different things that start to show up, challenges with cognitive performance. Those will kind of show up within the neurons. And so these neurons here, there's many neurons inside your brain, and they fire back and forth to send messages, and that's how the brain function happens. Okay, so that's just a little example there. Sometimes, if there is a need for in-depth testing, and I didn't want to go too deep today, but just to kind of tell you, the primary care physician can also refer to a neurologist or a neuropsychological testing type thing. And that just gives more information, with behaviors, mood, different things like that. It can be a lot more in depth. Okay, and I'll turn it back over to Sarah.
Thank you. We've had a really good turnout, so we ran out of handouts earlier, but now we've got more copies. So if you didn't get one, please feel free to ask me afterwards. So Rob already talked about some of the metrics or some of the symptoms. I put together this list of measures that pretty much most cognitive tests would look at how well a person is functioning in these areas. So right at the top, getting lost when traveling to an unfamiliar location. I mean, that happens to all of us. But if you see a pattern, or it starts to become a regular thing, then perhaps it is worth looking at. But then you can't look at any of these metrics in isolation. They have to be looked at together. Word and name finding troubles, right? How frequently does it happen? What are the kind of words that you forget? Are they simple everyday words or something very specific? Because that could happen to all of us. You may read a passage or a book and not be able to retain the material that you are reading. A person with mild cognitive decline may demonstrate difficulty in concentration. So you tell yourself, okay, I'm gonna get up and, I don't know, get some milk out of the fridge. And then 30 minutes later, that milk is still in the fridge because you've started doing something else altogether. Some amount of that happens to everyone, but then once again, look at the patterns, see how often that happens, right? And that's also, it depends on the nature of the task. How urgent is it? If it's urgent, if it's about safety, security, it's about, it's health related. If those kind of things are being put off, or they just slip your mind, then that's worth looking at. Not being able to remember names, once again, there's a pattern to it. If it happens once or twice with a person you just met for 2 minutes, I don't know, 20 days ago, it's not such a big deal, but if it's a recurring thing, yeah, it could be an indication. Denial is another one. And most often, people who live with you will start to notice these changes in behavior and memory. And if it's pointed out, a person might deny it altogether. And losing and misplacing objects of value. So these are just some metrics. Now, one thing needs to be kept in mind. Mild cognitive impairment does not mean that you're going straight into dementia. That isn't the case. It may or may not be, but that, if you have any of these symptoms, it doesn't spell dementia for you. But Um, there are, as Rob will later tell you, ways in which you can, after you've recognized these patterns, you can start to do things on your own to improve your cognitive skills. So for that, I'm going to hand it over to Rob again.
Okay, so some medical conditions and lifestyle factors that increase the risk maybe of mild cognitive decline. Age 65 and over, having a form of a gene known as the APOE4, which is kind of linked to further cognitive decline. Diabetes, smoking, high blood pressure, high cholesterol, a traumatic brain injury, obesity, or obstructive sleep apnea. Okay, some areas that can improve and have a positive effect. Hydration is one of those things that is so important, and being dehydrated can actually alter cognitive function. So we always say, let's drink more water. Be aware of the water you're drinking during the day. It has a big impact on the body's function. Social isolation can also be one of those factors that can present some cognitive decline. Depression, anxiety, vitamin deficiencies, things like vitamin B12, probably heard of that. That's one that's taken commonly to boost cognitive performance. And of course, sleep can be a factor in just your ability to function well. Okay. So things we highly recommend. Okay, increased movement and exercise. And the wellness center here is such a wonderful new thing to our community. Even walking the hallways, even that. I mean, there are long hallways here, so it's some great space to be able to stretch your legs, get your blood flowing, and just a wonderful way to increase that movement. Okay, socialization is a huge part of maintaining good cognitive performance. Meals with friends, activities, or simply placing yourself in an area with a lot of passersby. So, there's a lot of wingback chairs around here, a lot of benches, different places to sit, or, sitting in the hub, if it's just grabbing a cup of coffee or something, putting yourself in a place where there's a lot of folks passing by, people to talk to. Challenging yourself to learn or try new things. A lot of fun card games. I know there's, manipulation, hand and foot, I've heard of. And tech talks, there's someone that comes to talk about technology. I know technology can be a little overwhelming when you're not used to using those kind of devices. So, maybe if a family member has gotten you an iPad or an iPhone and it's just you're not familiar with it like you would like to be, they have those tech talks. So that's a great way to challenge your mind. Because you can do it, you can learn, and you don't have to know everything. Just the simple things. And things like Tai Chi, that's just another one I was thinking of. It's a great way to move and be around others. Getting your hearing and vision checked, very important. If you're not hearing others well, you can misinterpret communication, right? And misinterpret a message, or not being able to see well. All of these things can make your daily routine more challenging. Okay, so we have, I think, is it AIM Hearing? They come to the campus, and so that's a great way to have your hearing checked. I mean, for them coming here, that's wonderful. And I'm not sure is there an eye doctor that comes, an ophthalmologist that comes here, or that might be something you would have to go out for. Not sure about that one, Counseling services offered here at Friends Home. So there is a counseling company, a counseling service that comes to Friends Home. It's a new company that we're contracted with, and they will come here. And so, you know, I know there's got to be a lot of, you know, there's difficulty in, well, different things that happen in our lives. And maybe coming here, coming to a new environment, dealing with that change when you've lived somewhere for so long, all of those different things, you know, the counseling service would be a wonderful way to get those feelings out and to, you know, like I said, depression can make your cognitive function a little bit difficult. Okay, so activities at Friends Home. So we have things like Icon, or also you can see that other symbol there is, I guess, the app that you download. If you are into that, you can see all the latest and greatest Friends Home news, both Guilford and West. And so, but if you're not wanting to go the technology route, there's still the paper newsletters, which, you know, they are full of activities and things going on. So there's a lot of different ways to get plugged in. So I think, you know, putting yourself in social scenarios, even if you're an introvert, you know, social exposure matters. So you don't have to show up somewhere and be the most talkative. Just to be around others is uplifting and good. It's a good thing to have in your daily routine. And I've seen the concept of the community tables here. I believe there is, so there's one in Cobles, and I believe there is one in the Hub, correct? Yeah, so that is a wonderful thing. And that's a great way to meet new people and, you know, challenge yourself in learning new things. So, yeah, those community tables are wonderful. Right. So the best part of all of this, and I know it's a lot of information, a lot of things to take in. It's hard to kind of pack it all in a short conversation here. So I think in talking about you know, cognitive decline, functional decline, I think it's good to just bite off small chunks. So I plan to do, Sarah and I plan to do some further talks and kind of a series of talks, and maybe getting more in depth in certain areas here. So we get to walk this journey with you. Okay, that's a wonderful thing for us to be able to be a part of your journey here at Friends Home as a speech therapist. And, you know, like I said, the swallowing, the cognition, voice, whatever it may be that you're having difficulty with today, specifically cognition. But we get to walk the journey with you and help you. We want to help you maintain the highest level of functional independence, and that's being able to stay where you are as long as possible, you know, safely. You know, you want to live each day to the fullest and have a good quality of life. So we would love to come and help you with that, kind of navigate and talk through the vulnerable topic of cognitive decline, because it's not an easy thing. So Sarah and I, we can come to your independent living apartment, to your villa, to your cottage. You don't have to come over to a certain area here. We can come to you, because we like to be in your personal environment, your setting, so we can see, you know, how you're functioning in your routine. So that's it for today. That's what we had in mind. Again, Sarah, and my name's Rob, and we're with Trinity Rehab, and our office phone number is there. We would love to hang out and chat with you guys afterwards. If it's easier to call us and talk through things, or pull us aside at a different time, we would just love to talk with you about what it means in working with us. But hopefully this has given you a good snapshot of what cognitive decline or a mild cognitive impairment looks like. But thank you all so much. Yes. Do you have any questions? Anyone want to ask a question? Yes.
Could you speak for a moment about anesthesia and how it affects cognitive abilities?
So anesthesia, okay, and how it affects cognitive abilities. So it can definitely, it is much harder, as you all know, they say it is much harder for an older adult to come out of anesthesia. So it kind of leaves a foggy state. Not always. It's kind of a case by case, right? But it can leave a kind of a foggy state and take more time to come out of that. So that can be something that we would help to address and develop strategies and ways to cope with what's happening. So, any other questions? It's hard to speak up in a group. Oh, you got it? Okay.
In terms of using tools such as keeping lists, setting an alarm to remind you to do something, is that a good strategy, or should you be trying to work to just remember?
Yeah.
Do you want to speak to that?
So it has to be a combination of different things. It can't just be one thing. The idea is that your entire lives, all of you have developed and followed a routine. And what starts to happen with some of the symptoms that we had seen is that the brain also, so I talked about awareness and insight. If there is mild cognitive decline, there is a certain chance that the brain itself will not be able to do that kind of planning, right? We often see cases in which when it goes further than mild cognitive decline, a patient stops to care about grooming, about caring for themselves. There is also the issue of insight and denial. So the brain's not able to recognize that there is an issue here to be resolved. So it has to be a combination. I think the two key things that we see a lot is just lack of motivation to do things or to get work done. That's one thing. And then memory. So keeping that routine helps with the memory, and it improves motivation in terms of just having a checklist and being able to strike out work that you have done already. That gives one good motivation. And at the back of your mind, you just have to remember that there are times when you will not want to follow that routine or maintain a calendar, but it needs to be done because this is now scaffolding for a function that the brain used to perform on its own, right? So we always call them adaptive or compensatory strategies, because now we're bringing in tools to do this, okay? I hope that answers your question.
Almost. I'm thinking, I find it helpful, to set the alarm to remind me to open the dishwasher.
Yes.
Because I may get involved in something else and not remember. Is that a good idea? Because that's a strategy to help me remember to do a task that's easily forgettable.
Absolutely.
Or is that a crutch that we shouldn't be depending on?
No, you should be setting as many reminders as possible. It doesn't take away from any residual memory that you have. It only supports it, enhances it. And one of the things that, one of the new technologies that you should consider investing in, it would be helpful, are these AI-based sort of voice recognition tools, right? So Alexa and Echo, we use it, well, I use it all the time, Rob, do you? So, you know, I'm standing in my kitchen and I would just set up a reminder that in 10 minutes, I should be checking on something that I needed to check on. So it supports our memory. It doesn't take away from the residual memory.
And I can say too, to that, a lot of times, you know, if that involves technology, learning new things, being able to go through the steps necessary to set an alarm, if this kind of thing is new to you, that's what we also do, because that involves sequencing and problem solving, being able to recall how to do. So that's an area that we can also focus on with you.
Rob, I have a whiteboard in my room that is, I couldn't live without it. I could write what I have to do every day, you know, all day, and then erase it, and the next day I put what I have to do.
Mary Ann right here was saying, you know, she has a whiteboard that she uses in her living room, and finds a lot of value in that. So that's kind of, we could call that a low-tech type device. You know, just writing information down as a reminder. So yeah, these are all great tools. Thank you all so much for coming. I will mention really quick, our rehab manager, Mark, is in the back waving. So you could always go to Mark and ask questions as well, and you can field those our way if necessary. Yes?
Can you make your outlines available to people who would like to have a copy?
Absolutely, yeah. So we have a sign-in sheet that has kind of made its way around on a legal pad. So if you will find that and maybe put your email address, if you're interested in having some of this information from our talk today, we're more than happy to send that to you so you can look through it a little bit more. Yes, yeah, and I'll look into putting it on Icon for you guys, so that maybe it'll be accessible there too. That might be the easier option. So we'll try to cover multiple bases in making that available to you guys. But yeah, absolutely. So we've gone through several things today. So yeah, absolutely.
Hey everybody, I don't know that I've met all of you. My name's Heather. I'm a PT with Trinity. I work all over North Carolina in various of the CCRCs, and I've been here with the Trinity group since March of 2022. And I was talking to Mark before about how great it is today to see you all here. This is such a huge turnout for something that historically, I know Rob can tell you, years and years of working with residents on this has been a topic where there's been a lot of stigma and people have shied away from coming and learning. And I am so happy to see you all here today and engaging in this. I think this shows such proactivity and insight on your parts to take charge and take advantage of the services that these guys are here, and they're willing to talk with you, and it is such a tricky line, you know, that should I use reminders, should I try to remember, should I use my whiteboard? So funny, as I'm listening to this, I have a 22 and a 19-year-old. Yes, use the reminders. Yes, use the whiteboard. One has a whiteboard, one is, you know, reminders in the phone. To my parents who are in their 80s who are using a calendar for everything, and my mom has gone beyond the normal aging process into the cognitive decline and to see the strategies. So thank you all for coming today. We very much love having you here as part of this community and want to be able to serve you in any way that we can. So thank you so much.
It means a lot. Yeah, it means a lot to us. Thank you guys. We're here for you, so don't hesitate. Okay? Thank you all so much.
I played a game. I played a game.
Right here.
Here's an extra one back.